Greetings pharmacology students, and welcome to week 8 focus video. This is our last week of content. This week we're covering drugs that affect the immune system. So it's chapters 15, 16, 17, and 18. You'll also have a VSIM. Your final VSIM is due during week 8, and that is scenario number 6 on patient Harry Hadley. So as usual, your weekly quiz will close on Sunday evening. But because this is the end of the course, I'll also be opening the final on Monday morning, 6 a.m., and that will close on Wednesday evening, 10 p.m. And just a reminder that the final for this course, since it's only 8 weeks, is not a comprehensive final. It is simply an exam on the content that was presented during weeks 6, 7, and 8. And you can expect that it would be very similar to the midterm, quote midterm, that we took in week 4. So it'll be 40 questions, and each of those questions are worth 2 points. So this might be our final focus video. What I'm learning is that things have changed a little bit for online courses. In the past, I have posted it's called a end of course survey, and it's set up to be, in the past it's been set up to be generated as an anonymous survey, and it's your opinions, obviously, an evaluation, a course evaluation of the course content, the course format, of course the instructor. But things have changed, and that's no longer actually part of the Canvas course. In lieu of that, you will be getting an email from the college asking for you to complete, it'll send you to a link asking you to complete an end of course survey. Let's get into week 8 content. Week 15 is an overview of the immune response and the inflammatory response, basically inflammation. I say review because you've probably had this before. If not, this is a great chapter to dig into. Remind yourself, like on page 254, what is the first line of defense? What are our barrier defensive mechanisms that everybody possesses? And then also it goes on to refresh your memory about the role of the individual white blood cells, the white blood cells as a group, and then the individual, those 5 different kinds of white blood cells, and what they're all responsible for, and then the immune cells that are produced by the body. The glossary for this chapter, there's a couple of terms I just want you to refresh yourself on, and one is the word antibodies. We're not talking about antibiotics, medications. We're talking about antibodies that are produced by your own body. Antibodies, also known as immune globulins. The word antigen kind of goes hand in hand with antibody. Antigen, antibody. What is an autoimmune disorder? What is the definition of an autoimmune disorder? And then what is the role of those B and T cell lymphocytes? These are definitions that will come out of the glossary and again during the reading. Moving on, review the role of histamine and what happens in the process when, the inflammatory process when histamine is released. And there is a great video, actually there's 2 great videos in this chapter. The first is, and they're short, 3-5 minutes, a video on the inflammatory response. And it actually shows, some foreign object going into a finger and what's happening. What happens in the tissue, what happens in the blood vessels, and then what cells are starting to be activated. So look at that video, at the very least look at that video, because it's awesome. And it's very comprehensive, and you might want to watch it even twice. So review the inflammatory process. What are the 4 signs and symptoms of inflammation? And what is the role of bradykinin? They refer to it a little bit in this video, but you can read about it as well, where it talks about the kinins. Specifically, bradykinin is responsible for that increased capillary permeability that allows some of these cells to move in and out as the inflammatory process proceeds. other video I want you to watch is a couple of pages down, is the immune response. That's different than the inflammatory response, the immune response. And this will refresh you on those B and T cell lymphocytes and what their individual role is. The role of the T cell basically has to do with recognizing self cells, and the role of the B cell has to do with initiating that antibody formation in response to certain proteins that it recognizes. So look at that immune response video and read about the B and T cells. And again, I already mentioned the definition of autoimmune disease, and that is all you have for chapter 15. That's all that I'm concerned about that you take away. But there's a lot in there, especially when we're talking about the inflammatory process and the immune response process. Moving on to chapter 16, medications that we take for these various situations. Anti-inflammatories, anti-arthritis, and other related agents. That's chapter 16. So discuss the use of anti-inflammatory agents. When do we use them? And I can tell you that anti-inflammatory agents might be in competition for the most abused medication in our country, aside from pain medication possibly. Because most anti-inflammatories, many are available OTC, over the counter, and you get them in giant jugs at Costco or Sam's Club, and they cost less than $5, and they make me feel better. They make my knee feel better. They make my back feel better. Why can't I take them all day, every day? That is an example of not taking these medications as prescribed. So in this chapter, you're going to read about some of the perils that people unknowingly face when they don't read the directions, or their doctor doesn't know that they're taking these medications. And very often, these medications aren't even reported to the provider during an office visit because the patient buys them themselves and they don't need a doctor's prescription or permission. But the use of over-the-counter medications is very important for the provider to know, because, mark my words, they do interfere sooner or later with other prescription medications, and there can be terrible outcomes, liver failure, kidney failure, when some of these medications are taken not as directed. So in this chapter, I want you to look at the use of salicylates, the group salicylates, and specifically look at aspirin as our chief salicylate that we use in this country. So if you know how aspirin works, you'll understand how the salicylates work. We'll get into the next category of non-steroidal anti-inflammatories, very often available without prescription over the counter. The prototype I want you to look at for NSAIDs is ibuprofen. So read about ibuprofen. If you understand how ibuprofen works, you'll understand how many of these others work. There's another one I want you to look at in this category, and that is ketorolac, Ketorlac, also known as Toradol. This is a prescription medication. We give it in the hospital very often post-op. It's a powerful non-steroidal anti-inflammatory that has some potentially lethal side effects if it's used incorrectly. It's meant to be used short-term, meaning 3 or less days. And you have to there are many nursing considerations, and actually there should be physician considerations too, including, is this patient properly hydrated, for instance? Some of the problems with Toradol, and we've seen it in some NFL players because they get it injected during halftime or whatever their trainer is giving it to them. And it allows them to go back out there for the second half of the game and act as if they have no pain at all. It's a great adjunctive medication when you're talking about someone who is post-op and needs perhaps narcotics. In some cases, you can give Toradol and not give the narcotic, which is great because narcotics have so many side effects. The respiratory depression, the GI motility issue, so many ill side effects that can be avoided if we give Toradol, but again, only as meant to be used for that very, very short term. It can also cause GI bleeding, and which can be fatal depending on how it's recognized. It is not recommended for children. And again, it's a great drug, but only when it's used as directed. So I want you to read about Toradol, ketorolac. And then the last drug to look up in this category is acetaminophen, that we know as Tylenol. So the three that you're probably familiar with are aspirin, ibuprofen, and acetaminophen. You may or may not be familiar with Toradol. And that's what I want you to get out of this chapter 16. Moving on to chapter 17. The chapter 17 is about our immune modulators. And I want to say in this chapter, I would think of a steroid as an immune modulator. They don't really emphasize steroids that much in this chapter. But do know that there's mention of them. But do know that when a patient is on a steroid, that is the steroid itself, the action is going to suppress the immune response. So all those signs and symptoms that we're looking for when someone's got an inflammatory process in play are going to be tamped down or not noticeable. I do want you to look at steroids. It's actually in the glossary for this chapter, as well as immune stimulant and immune suppressant. So in general, you're going to read about what are the actions of immune modulators, what are the indications, when do we like to use them. As far as classifications, you don't have to deep dive into this, but know the difference between interferon and interleukin and when you might see those used, what specific patient population might be on an interferon medication or an interleukin. And then also, what is the adverse effect of B and T cell suppressors, which these are? What happens when your B and T cell immune response is suppressed? And that's it for chapter 17. For chapter 18, this is about vaccines and sera. This is big in my mind, and I hope that I'm not speaking to any anti-vaxxers out there. If you're coming into the nursing profession, you pretty much have to get on board with the idea that the vaccination or the immunization program in our country is very important. And unless you've got very specific medical reasons why your child cannot tolerate a vaccine, there's actually a research box in this chapter that it doesn't go into depth, but if you specifically are interested for being able to intelligently dispel the link between vaccines and specifically the MMR vaccine and autism, send me an email and I'll send you some links to stronger literature and also some documentaries that you can watch or have your family members watch. You happen to have people in your life who do not believe in vaccines. In this chapter 18, in your glossary, I want you to look up and know the definitions of active and passive immunity. What is a sera? What is a vaccine? Sera, it's the term usually is immune sera, S-E-R-A. What is a vaccine? I mentioned active and passive. And then what does the word immunization mean when we refer to the immunization process? What exactly are we talking about? So discuss your indications for vaccines. There's also a table in this chapter that gives the vaccine schedule, the recommended vaccine schedule by the American Medical Association, the American Pediatric Association, et cetera, about when and what vaccines children are to get at what ages. And even coming into the nursing program, you may be required to get some vaccines that you haven't gotten yet. Hepatitis B is one. HPV, 10 years ago we were recommending HPV only for females. Now we're recommending HPV vaccines for males and females. Educate yourself about that. The overall takeaway from this chapter is what are the nursing considerations and the patient teaching points for patients who are receiving vaccines and or immune sera. And how can you, parents, feel confident in their choice to proceed with the immunizations that are recommended for their children? And that's the end of our content for week 8. Don't forget that you have that VSIM to do, as well as the week 8 quiz, and then look for that final exam, which is over weeks 6, 7, and 8. Thank you very much. I hope you have a good week. I've enjoyed teaching the class. It's kind of hard to teach online when you don't see people's faces or get a lot of feedback about what's going on. But I hope this class has proved valuable to you. If nothing else, you come away with the awesome responsibility that nurses have professionally, according to their professional role as defined by law when it comes to medication administration. I don't want you to be robot nurses. I want you to be critical thinking, responsible nurses that serve as a patient advocate, that are capable of educating patients, and will always use your drug lookup. Always use your drug lookup when it comes to medication administration. Trust me, your patients will not think you don't know what you're doing. Your patients will appreciate that you are taking extra steps to ensure their safety. And I wish you luck as you get into the program, and maybe our paths will cross again in some other course. Who knows? Thank you, and good luck to you.